Okay, so in pharmacy, I don't even know where to start, but let's just do this. That this is 2026, and I'm going to commit to posting at least one video for the next 7 days. Let's try that because I don't know if that's going to work, but I'm going to commit to posting one video for the next 7 days. And I won't call it a series. I'm just going to talk about mostly things in pharmacy relating to compliance, regulatory compliance, regulations, just normal things because I kind of good in that area. So let's just talk about that. First of all, I've been a pharmacist. I graduated 2007 December, got licensed in 2008. So I have been practicing pharmacy as a licensed pharmacist for 17 plus years. So I know a thing or two about pharmacy. And one of the things I have to talk about is that when you first get licensed as a pharmacist, yeah, it's a lot to have all that weight on your shoulders. You're responsible for people's lives, but the training that you've got adequately prepares you. I think when you first go into pharmacy as a licensed pharmacist and your first day shift, I remember the first day I worked. To be honest, my very first shift as a pharmacist, and I don't like to say this because I literally I try to hold this really close to me. My first shift as a pharmacist was not as a pharmacist, as a licensed pharmacist. When I took my boards and passed my exam, I remember we were voting in 2008 and Obama was running for president. And I remember that morning I was hired by one of these big chain corporations and I went to work. And I was so sad because I couldn't vote. That was the 1 year I did not vote. I could not vote because I had to be at the pharmacy from opening to close. Um, yeah, I couldn't vote. By the time I got off work, all the voting polls had closed. And by the time I went to work, the voting polls had not opened because, first of all, I had to take my son, who was a little over a year at the time. I had to take him to like daycare type setting. So I had to take him to his daycare and then I had to try to get to work. So the commute and all that. Anyway, long story short, Obama became president, but I did vote for him the second time. So kudos to me. Did my thing, rocked it. But now let's get back to the pharmacy thing. I'm going to talk about different topics for the next 7 days. So in this one, I'm going to talk about misbranding. And I also want to stress the fact that when you first get licensed as a pharmacist, it can be a little bit intimidating, especially these corporations, when they try to bully you and force you into doing some things that are unethical. A lot of them are very unethical, extremely unethical. I am saying it and I'm saying it pounding my chest because that has been my experience and multiple documentations. So anyway, let's get back to this. Misbranding is what we're talking about today. That's going to be the topic of today, misbranding. It is so rampant in the industry that it's crazy. Okay, so we're back to misbranding. Sorry, I had to attend to something. So we're back to misbranding. So this is what's going to happen. Misbranding, it's very detrimental in pharmacy, not just to the industry, but also to the patient as well. Because when a drug or a product is misbranded, it can cause tremendous harm to the patient. So now let me give you an example. And also, it's against the law. It's considered fraud, especially so you have a drug. We're going to use duloxetine, okay? 30 milligrams. So this brand is by Lupin, all right? And then we have another one, duloxetine, 30 milligrams by Agenta. Same medication, different manufacturers. But guess what? The drugs don't look alike. They're different. See how this one is? Completely different. And look at this one. different. They do the same thing, but they contain different inactive ingredients. So when you print a pharmacy label and the drug is billed to the insurance and say, this is what we're billing lupin, and for some reason the pharmacy doesn't have this in stock, or the pharmacy doesn't have enough, a lot of pharmacists will dispense what they have in stock without actually changing what's on the label. Not only is this illegal, it can be extremely dangerous for the patient. And I'll tell you why. And also, it's bad for the industry. Now, pharmacists get reimbursed based, especially with insurances, get reimbursed differently. So some NDCs would give you a higher reimbursement than other NDCs. And so that's fraud in that sense. And also it's mislabeling, so which is against, it's a federal regulation that you're breaking, not just the state laws in Maryland for pharmacy, but also federal regulation. And also it's really bad because patients might be reacting to the inactive ingredient in one medication, and now the label states that they have a different medication, a different NDC. The color shape would not match. And then when it comes to recalls, it affects recalls. This is used to treat major depressive disorder. It can be used for generalized anxiety, neuropathy, so many other things. I'll come back to this. I'm running out of time. I'll come back to this.